Good morning, everyone. I want to say thank you for coming this morning. It has been an interesting couple of weeks that we've been experiencing. Just for some of you that haven't met me before, my name is Anna Kinder, and I'm the Executive Director of the Natrona County Health Department, and Dr. Dunn will be joining me momentarily. He is just in transit from the hospital to here, so he'll be here in just a moment. But we wanted to take time to update all of you to kind of give you some clarification on what's going on in our community. It drastically changed just in the last week. Also clarify with things have changed a little bit with testing, the use of the vaccine and what that means for quarantine and isolation. So we're hoping that by giving you information, you can pass that on to your employees. But what we're finding and what we're seeing is the impact on workforce, taking people out of what we would want to be doing every single day, but how things have changed with the new Delta variant that we have in play. So the Casper-Natrona County Health Department, our focus this round, or we've never really stopped, but we're really going to be focusing on education, testing, and vaccine. Those are the only areas that we're going to really promote. We work with Callan Marketing. They are helping us get out as much information as we possibly can. The Casper v. COVID is still an excellent resource for you to go to get current information, as well as the Wyoming Department of Health COVID information as well. Testing, we have a lot of testing opportunities going on, as well as vaccination that we are doing. But what we've seen, just the way the state does reporting that we are commenting to right now, is the week of July 26th. All of the numbers that are reporting prior to that, we had 41 cases. So the week before July 26th were 41 cases. All the weeks prior to that were right around 20. We really didn't get too excited for I want to say a couple of months. Cheyenne never really dropped. They continued to have 100 cases, and we just kind of watched what was going on, what they were experiencing. Still kind of talking behind the scenes that we didn't know what was the difference between us and them. Not that we wanted it, but just kind of kept an eye on things. We didn't have any pools of transmission, just family members here and there, just one-off kinds of things. But the hospital did start to increase. Dr. Dunn, you'll need to come up here. Your slides are coming. But most of the cases in the hospital at that time were the unvaccinated. Then the week of August 2nd, which would have been July 26th, we had 81 cases, so we doubled in that time frame. Most of that was community-based. Hospital continues to increase, and we started seeing some of our first deaths. Week of August 9th, the reporting was 171. So what we saw last week that was reported this week is there's cases in all counties across the state. Even in Niobrara, Crook, some of those counties that have not had any reportable cases for weeks on end now have substantial. Everyone has taken a significant increase. Cheyenne Frontier Days was a lot of the cases that we saw. One morning when I was kind of helping just kind of track what was going on, the number of people that came in that just said, my only exposure is I went to a concert at Cheyenne Frontier Days, or different things, and they were very sick. They were young, just knew something wasn't right and came in for testing, and we were able to tell them that they were positive. We saw outbreaks in churches, and we're experiencing a lot of things with young people. It's much younger. Yes, sir.
Are these cases normal COVID cases, or are these the Delta variant cases, or is it a combination of both?
So we are assuming and going with that everything is the Delta variant at this time. And we'll talk about the contagiousness. It's not even a word. I don't even know. How virulent it is and how it transmits between people so readily. But it's affecting the younger population.
That's what I get for being late. Sorry, going to the front. Just real quick on the ease of transmissibility with the Delta variant. I don't want to bore you with too many of the biomolecular things, but imagine last fall, last spring, when we were talking about COVID, basically when someone was infected, then they could potentially infect 2 to 4 people around them. On average, about 3. That's a really bad influenza season, a little worse actually. However, with the Delta variant, it's somewhere between 5 and 9 people per one person infected. So that one person that's infected can infect up to 5 to 9 people around them. On average, about 8 people actually. So it's quite the transmission is it's the real deal. It's on par with chickenpox. And that puts influenza and the cold virus, any of the cold viruses, to shame in terms of the ease of transmission. Pretty significant. And just briefly, mutations, that's what viruses do. They evolve. That's what variants are. They're mutations of the original strain. And so there are a couple of mutations on the spike proteins on the virus itself that allow higher affinity of the virus to attach to that cell, our cells. And then there's a higher affinity to replicate the RNA through a protease mechanism, ribosomes. That's way more efficient than the alpha variant or the variants before that. So if you imagine the alpha variant, and I always hate to use regional endemic data, but the alpha variant, basically the UK variant that everyone talked about in January, February, March-ish, that was about 40% more transmittable than the strain that everyone experienced in the spring of 2020. So the alpha variant was quite significant. And the Delta variant is about 60% more ease of transmission than the alpha variant. So you're on a tenfold increase of transmission with the Delta variant as compared to this, what we were facing back in March and February of 2020. So pretty significant. I'm late because it's busy in the hospital. Oh, thanks. Unfortunately, this slide is a normal chest X-ray. The black is air. That's what you want to see. You see the heart. That's not normal. That's not good. This is actually from this is a real case. What we're seeing demographically of the patients in the hospital, they are younger. And partly because the group over the age of 65 have done a really much better job of vaccinating than the younger crowd. So that's definitely what we can draw some association to. But the fuzziness is it's all inflammation. It's basically. You could call it a multifactorial pneumonia. You could call it almost ARDS, acute respiratory distress syndrome. But the point is, when I was in the hospital 3.5 months in the fall last year, I would say anecdotally 5, 6 out of 10 patients that I had would develop this kind of sequelae in their imaging. And now, unfortunately, it's happening probably 8, 9, this is anecdotal, 8, 9 out of 10 patients are coming up with these images that just clearly show that our lungs are inflamed, ticked off, really fighting something pretty significant. Here's another one, the 41-year-old female. She was diagnosed with COVID in the beginning of August, and you can see there's a little black to demonstrate air, except for that left upper lobe, and that's all bad fuzzy. And so quite significant. When you dealing with that, you go through different oxygen titrations, nasal cannula, mask, and then you get to what's called CPAP, BiPAP, which we'll talk about. And then the end game would be intubation. And we want to try and save off intubation for folks because it's harder to get people off the ventilators with COVID pneumonitis or pulmonary fibrosis from COVID. So this is a CAT scan. You're looking at the CAT scan going this way. And again, you see the heart in the middle, and you can see so you can go back one. I'm sorry. It's normal CT with the black. That's the lungs. Thank you. And the next one, this is a patient, 54-year-old female, diagnosed a little bit later in July of this year. And that's basically when you're looking at the X-ray, the 2 view, you're seeing the fluffy whiteness. Then that's the 3D look at it, and it's significant. that's hard. It's hard for your lungs to clear. And when people have those kind of radiographic findings, especially for COVID, they're tachypnic. So they're breathing at a pretty rapid pace, trying to keep up. They're trying to ventilate as best they can. And so normal respiration, high teens, 18, maybe 20 a minute. Then you get to mid 20s and then 30s per minute. So if you're breathing 30 times a minute, it's one every other second. You're going pretty good. So imagine trying to keep your ventilation up and doing breathing 30, 40 times a minute for a couple hours. And you can see it's quite taxing on your body. Thank you. And so once you get from the, oh, thanks. I could have, sorry. Yeah, this is just an image of what that machine, it's BiPAP. It's an older version of a BiPAP, but when we go from the nasal cannula to the non-rebreather mask to non-invasive airway management, it's that shoebox-looking machine on the to the left of that patient, but it's pushing air in and helping pull air out, and it's the step before we go to intubation, and we're seeing this more and more as well. So it's quite significant, unfortunately. Thank you. And the other thing that we're not talking enough about, I think, as a medical community, is the long haulers, especially from last fall. The long haulers meaning people that unfortunately came down with COVID-19 and still had symptoms past 12 weeks. You can actually make a case for after 4 weeks, but that's a different category of long haulers. But we're finding people that have fatigue, ongoing fatigue for 4, 5, 6 months, issues with concentration, almost like post-concussive symptoms. So if you've ever seen someone with a really bad concussion, they're a lack of concentration. You could have some mood instability, depression, anxiety, sleep disorder. So trying to manage the morbidity associated with COVID, and not just the mortality, but the morbidity going forward. So trying to keep people with behavioral health things. We all know about suicide in this state. We all know what illness can do in terms of a grief reaction. And so we created a long haulers clinic at MESA Primary Care, but it's doing it around the country. And we linked up with a clinic in Boston and one in California to use their model of their screening for patients who've had COVID and still have symptoms that are quite significant and debilitating. So we need to also realize that the morbidity associated with COVID infections up front can carry over past 12 weeks, and it's quite debilitating. And the last thing, long-winded, I apologize, but the pediatric population. So I mentioned the transmission ease of COVID, the Delta variant, but I failed to mention about the viral load. The viral load is the amount of virus that one person has when they're infected. And it's not just when you get the viral load, but it's when your cells replicate the RNA to make the viral copies, and then you exude it to people around you. And this is the worry for the pediatric population. Now that we have a virus that is way more transmittable, and also the viral load is quite more significant than the previous variants that we've seen of COVID. Our kids are going to be exposed to a higher viral load, so a higher risk of contracting COVID-19, which is scary if you look at what's going on in Louisiana, Texas, Florida. I have I have 2 friends that are pediatric intensivists. One's in Michigan and the other one's in Houston. And what you're seeing in, any news source is significant. I don't even want to talk about mortality, but just having kids in the hospital, there's just nothing worse. So this is going to be an issue. And then going forward, last thing, the long haulers for pediatric population will also be very something that we'll have to watch out for as a medical community. Thanks.
So you can answer questions, whatever. So basically, we're back to some of the things that we talked before. Some of the stuff probably didn't go away, but the cleaning procedures, making sure that those stay intact, washing hands, using hand sanitizer. It's hard to believe in 2021 we're still talking about washing hands, but that is one of the best ways that we can use to protect ourselves. Face coverings are optional depending on the exposure or personal preferences. It's effective. We note that it is effective in preventing infection and slowing the spread. It is recommended by CDC to wear masks indoors in those areas that have high transmission, which now Natrona County is one of those. But I think the biggest thing that we're asking people to do, and I can tell you even at the health department, is if you're sick, stay home. Don't come to work, because we're already super short-staffed. We have 12 to 13 openings. I have 2 COVID responders where I used to have 25 COVID responders. So if I have one person that comes in, transmits cold, flu, COVID, whatever, then I lose that much of my workforce. So unfortunately, we have a lot of smoke in the air that gives you the sore throat, the runny nose, the coughing. We also have colds that are floating around right now. So the symptoms all replicate each other very nicely, very well. So if you, when in doubt, just stay home. That is our best message that we can have. I did have a staff member that came, she went camping with friends, came to work. She kind of sounded raspy, just didn't feel quite right, and she tested positive because it was, I mean, we've gone back to some of the normal activities that we would do. We go out to dinner, we do different things. We're with people we know, we're vaccinated, that person was vaccinated, all of those kinds of things. But now you've set in motion the risk of putting other people out. So I think workforce is going to be what we see the biggest detriment that we have moving forward. But even the vaccinated. So for myself, I could just have a runny nose. I could have a sore throat. All of those things, much like when we get the flu shot, you still can contract the flu. It's just a lesser variety of it. The same can be said about the COVID vaccine. We still can get COVID. We're just as transmittable to others. But we have allergies, we have common cold, so it's hard to like truly distinguish. If it turned us purple, that would be awesome. Then we would know clearly. But unfortunately, that is not the case. Anything to add? So what do we have available? Testing. So back, I don't even know, it's like a year and a half now or something. In the beginning, we didn't have a lot of testing technology available to us. We didn't have a lot of protective equipment, all of those kinds of things. That's why now we're a little bit different. We can offer more testing options than we did before. At the health department, particularly, we offer free testing Monday through Friday, 8:30 to 4. And we've partnered with MESA and SAGE, and we'll talk about that here in a moment, to cover the weekends. You can schedule an appointment, or you can just drive to the alley and you call the phone number and someone will come out and do the testing. The last 2 days, the testing line has wrapped around the building. And if you've been to our building lately, you know that that's kind of a feat with all the construction that's around there. So for those individuals that are symptomatic is what we do. And we are looking at those individuals that were in 5 days of being symptomatic. We do a rapid antigen test first. It's called Bionax Now. So we can get the information relatively quickly. If it is positive, we give them the information of what to do if they're positive, to get, go into isolation, those kinds of things. If the antigen is negative and they're symptomatic, then we'll go ahead and do the curative PCR test, which is mailed off to Los Angeles. And Los Angeles is experiencing a little bit of a increase as well. So our testing results don't come back as quickly as we would like them to do, but it is what we have available to us. The curative tests are taking 2 to 4 days to return, just as the lab volumes continue to increase across the country. We only want to use the rapid antigen tests for those symptomatic, and I think there's multiple tests in the community. Just learned of another place that's doing testing, and everything has just a little bit different twist. There's a little bit different expense with all of them as well, but not all tests are created equal. So we want to make sure that we use the antigen test for those that are symptomatic and within that 5-day period. And then the exposed but non-symptomatic people still can get tested, but we'll test them with the curative and mail that off because that is more sensitive to those individuals that don't have symptoms. When we talk, you can just call the phone number to schedule an appointment, as I said, for the symptomatic, or just come to the alley. We have found that we're getting a number of phone calls for people who need to get a test in order to travel or for elective surgeries. we've been trying to educate on that for, I don't know, quite a while, but those two situations still exist. We have the rapid PCR test, which is similar to the one that the hospital has. It's kind of more of the gold standard test, if you will. We do charge $100 for that test because it's an expense that we incur by doing that. We run them in-house. It's $100. You get the results. You can get it between a few hours and 6 hours, but a lot of it depends on the volume. And we can bill insurance for these tests, and they're used, again, for those that are having surgery or travel testing. We also have the ability to utilize that, though, for first responders or in situations that could make a significant impact to our community. So that is readily available in that situation. As I said before, we wanted to make sure that testing was able to be received by all citizens in the community, regardless of their ability to pay. So we partnered with MESA and SAGE, and MESA would be available to do testing every day, 8 to 8, starting this next week. Apparently there's a tent shortage with the state fair. I don't know. It's kind of a thing. So MESA will be doing that, and then SAGE, you also can receive testing that way. But just making sure that there's places for people to access, because it's gone as high as I think we've heard is $300 for a test at some places, and that's not what we need to promote out there for some people that can't afford that. So contact tracing, as of Monday, we are now going back to priority contact tracing. Those that will have significant impact are the ones that we're doing. We only make one phone call for individuals and leave a message, but we're not able to trace contacts. We give the information to the person who is positive to be able to share that information with their contacts of what they need to be able to do. But at this time, there's just no way. The lag time from by the time we find out a person is positive oftentimes is past the point of really being able to do anything meaningful. So we are going to that priority contact tracing again. We have tons of resources on the Casper v. COVID website for letters, different things like that a person would need to know or what they need to do to protect themselves and others, as well as the Wyoming Department of Health. And again, that continues to be our number one place that we put all of the resources to keep the information up to date. COVID isolation, those that test positive, it's a 10-day situation regardless of vaccination or non-vaccination status. If you're positive, the key thing is, though, is once I develop symptoms and I know what that date is, or I get tested. So for example, if I got tested today is day 0, tomorrow starts day 1. And so then I would have 10 days that I would not be able to go to work, and I would need to be isolated from other people. It was interesting, and perhaps you can address this as well. Dr. O'Bogan helped in putting this presentation together, that individuals that are hospitalized with COVID, they're actually recommending more of a 20-day isolation period. I don't know if you have any comments to that, but really looking at the transmission and the running of the risk of keeping everybody safe.
The thought is that if you're still showing moderate to severe illness, that you have active replication of the virus, the active viral shedding still that persists. So it's a little bit in the weeds, but you can have a reactive airway inflammatory response with cytokines, all these other things, versus pure shedding of the virus that's creating continued symptoms. That's our job to tease out and present, but that's why we put, when people have severe disease, longer symptoms, we talk about potential longer shedding of a viral load that person could have because they're expressing severe disease. So those that are asymptomatic or mild disease usually aren't expressing that same amount of viral load as someone moderate to severe disease who's hospitalized. So.
Thank you. So then we get into where it gets a little bit more interesting, the things that have changed since we've had vaccine come on the scene. So when a person is fully vaccinated, where they've completed both shots of the Pfizer or Moderna, or the one-shot series of Janssen, and they've had 14 days since their last dose, they can resume normal activities if they have no symptoms. So if I've been vaccinated and I'm exposed to someone, I can return back to work as long as I have no symptoms. We do recommend that they do wear face coverings just in the event that they could have contacted the virus. It's recommended, even if they remain symptom-free, that they get a PCR test days 3 to 5 after exposure. We really push more towards 5 in order for us to really get a clear picture of the person's response to being exposed. They should also mask indoors for the full 14 days following the exposure and continue to monitor for symptoms until you receive a negative test, which that's a controversial situation, and we're seeing that a lot at the health department right now. Is people, places of work are having their staff having to come back and get a negative test before they can return to work. Does not always work. Do you want to talk to that?
Yeah, again, don't want to get too much into the weeds, but there's residual RNA. There's all these factors that go into it. So really adapting to the new guidelines and to what we've learned and evolving with it. It's I always like to tell everyone it's a dynamic situation. That's what science is, and we have to learn and grow with the evolution of what our knowledge is regarding the transmission and our testing capabilities. And so without going into the weeds, it's just a very dynamic situation. That's why there are always updates and changes with guidelines and isolation and quarantine. It's
and we always run the risk of not getting a negative test because you can have it. How long was some of the longest that we've had?
6 weeks.
60 days plus. So that's not a really super solid indicator. So we're providing education as soon as it gets further clarified, then we'll put information out about that. But we really want that person who was came in contact to just watch for symptoms, really know what's going on in your body. As soon as anything changes, go and get a test and just remain home until you are confirmed that you're not positive. So that information was for those that have been vaccinated. So when we go to the unvaccinated or not fully vaccinated, remember, they have to have that 14 days. They must stay home following exposure. They still can do a modified quarantine if they wish, which consists of testing with a PCR test at day 5, and if it is negative, returning as early as day 7. The specimen may be collected and tested within 48 hours before the time of planned quarantine discontinuation. If they wish not to test, they remain asymptomatic, they can return as soon as the 10-day after exposure. Remember, starting with the day that I find out or the day that I first had symptoms is day 0. If the exposure is someone in their household or someone they have prolonged and continual contact, they cannot use the above criteria for modified quarantine until the positive is fully recovered and past their 10-day isolation. And I think we saw a lot of that in the previous rounds of COVID. If you're in the same household, your exposure happens the very last minute that you're with that person. So you are in the kitchen together, it starts there, and then maybe you see them, you're in close contact later on in the day. The time keeps starting over and over. So the vaccines that we have, as before, the Pfizer 2-shot series, 21 days apart, ages 12 and up. Moderna 2-shot series, 28 days apart, 18 and over. And the Janssen, also known as Johnson & Johnson, is the 1-shot, ages 18 and up. We offer a vaccine on a walk-in basis, 8 to 4:30 every day. We were ranging between 20 to 40, maybe once in a while we get a 60. The end of last week and the beginning of this week has been well over 60 every day. We do have our COVID response trailer out in the community. We will be in the city of Mills on Thursday and again on the following Thursday, back on 1st and Conwell the 20th. Just trying to get it out and make it accessible for people to do it. We're also being contacted by a number of businesses that we go in and provide education and then provide vaccine for their staff. That's why you may see extra cameras in here today, because we can't go to every business. We don't have the depth to be able to do that anymore. So we're we're putting something together so that we can give individuals that, and then we can work with them to get the vaccine that we need. We have about 23 vaccine providers that we can call upon. They range from nurses, retired nurses, pharmacists, respiratory therapists, and firefighters that we pull in and do, but it's also dependent on their availability. So I said respiratory therapists and some of the nurses. The hospital is going to a code red status, possibly because of staffing issues. They have 12 nurses out that are positive, something like that. So like the demand is moving over to the hospital, that's where their staffing will be, which means mine goes down. So it's going to be an interesting navigation period. This is what the state map. So this is for the entire state. Basically, you can see we just barely started in May, the 12 to 17 and older population in the blue. We have the 18 to 49 in the green, which is our highest group of people that are vaccinated in the state. The over 65 would be the second, and then those individuals 50 to 64 is right there under the top two of the older population, so that 50 to 64. And anecdotally, could you say like what you're seeing in the population of who's in the hospital?
Anecdotally, definitely the unvaccinated, first and foremost, and secondly, compared to last fall, the demographic is about 10 years, I guess, average, but it's younger. So whereas we had a lot of the advanced age population on our services last fall, it's definitely younger, 40s, 50s, 60s. We still have older as well, but it's definitely the majority of younger than it was last fall.
This is a map of all of the vaccine coverage. As you can see, it's not where I like to be because I'm a little competitive with Cheyenne, but they're winning today. But Natrona County, we're at 34.0%, but Campbell and Crook are our least, with Teton being our highest vaccinated county. So how are we preparing or just changing focus again? Wyoming Medical Center has moved to an emergency operation routine as of Monday. We're meeting and working with the school district, Casper College, long-term care and assisted living facilities, working with East Ridge Mall, again, possibly for boosters. I don't know when that's going to happen, but if it's not at the mall, I'll be coming to you, Tom, or needing supplies. We just didn't want to make it difficult for people to wonder where to go, that they went there the first time, we would go back to the same place. The mall has been sold in the last in the last month. So I don't know what that looks like. They're meeting this Friday to discuss the possibility of boosters. We're planning a presentation with Chamber of Commerce to give them some of the same information. As I said, we're doing vaccination special in the city of Mills as well as at Casper College. The federal government approved $25 incentives. That's what I based on what I was going to do with the city of Mills and with Casper College. However, President Biden came out last Thursday or Friday and will provide incentive of $100 for people to complete the vaccination series moving forward. So that is going to be administered through the state. I don't have the bandwidth to do that at this time, but the state is going to be coming out with that information in the next 2 weeks. But our biggest concerns is just the rapid increase. I can't tell you, like, every single day it's skyrocketing. People that I know who just went somewhere, came across somebody, they're positive. Like, the numbers are just remarkable, and it's happening so fast. It's very difficult for us to even navigate and know what we're doing. We're changing back our operations at the health department, where instead of doing our maternal child health, our adult health, everybody is going back to the COVID response because it's too fast this time. As we said before, and Dr. Dunn said, the Delta variant is highly contagious. We have a number of breakthrough cases, people who are vaccinated who test positive. The hospital is, I'll let you speak to that, But the surge is going to become greater than the personnel that we have this time around, I believe. But do you want to address what's going on in the hospital?
I think more for the country in that people are just getting sick. And I think if the hospital's ready, the hospital's doing a good job of building up different plans. But just to speak to the infectivity and the transmission, I think if we don't plan for the worst, then we can't meet it head on. So I think every healthcare setting in the state nationwide is really trying to get creative with staffing needs and different plans. And we're no different in Natrona County. So. Again, highly contagious, or Sturgis. There's all these different things. So I think I think all the healthcare settings are worried, and but that's why we're trying to be proactive.
We're not able to transport or transfer people.
Regionally, Colorado and South Dakota, and we're actually getting calls from other places outside of even our region to take patients. So there's a demand of beds, resources in the country, but also in the region. So you take a look at the pediatric cases in Louisiana. They're trying to ship out of Louisiana because they're filling up their own pediatric critical care beds. So we're experiencing not the pediatric part, but bed resource in our region, Colorado, everywhere, much like Wyoming is. So we want to take care of our own, if we can let all the other states take care of their own and really figure out ways to do it as creatively and as we can. And that's what we've been planning for since the spring of 2020. Again, better be proactive than reactive.
So basically, we wanted to make sure that we left plenty of time for any questions that you may have, comments, anything along those lines. Yes, sir.
So the state doesn't do lab testing anymore?
They do. We're just looking at ways to be much quicker, but the state absolutely is still continuing to do their PCR tests.
Okay, so if I have tests, I still bring them to you?
Yes, we still have the courier every single day.
So, Anna, I've got a couple of questions for Dr. Dunn. Doctor, last year when we were kind of in the midst of this, one of the key metrics was ICU bed space availability, ventilator availability. So I don't know if you can speak to what our current, census numbers are at the hospital on that. And then secondarily, as far as treatment, has that progressed at all? Is there, once you're hospitalized, have there been any new treatment options made available? And then finally, and totally unrelated, as a father with 3 kids under the age of 12, what is your recommendation for going back to school? And since you're seeing this higher virulence in the pediatric population.
No, thank you. I'll answer questions 2 and 3 first and go back to 1. Well, actually, let me do the pediatric one because that's near and dear to my heart because I have 2 small children as well. And the brick and mortar schools are very important for social development, the milestones, cognitive development. It's the American Academy of Pediatrics highly recommends going to the brick and mortar schools. I think our school system in Natrona County, private, public, have all done a really good job in mitigating some of those potential issues of transmission, and a lot to be proud of, actually, our school systems in Natrona County. Right now, what we're seeing is not the same as Louisiana, Texas, or Florida, we'll take that. My fear is I hope it doesn't get to that point. So right now, with masking being optional, I would recommend that kids wear masks. I recommend that they stay home if they're sick. I recommend testing. Testing is important because then you know what you have. And I think we've developed some fatigue with testing. So if our kids are sick, if we're sick, get tested so so we can stop spreading it. So stay home if you're sick and washing our hands, germ theory. So long-winded answer, but I believe in brick and mortar schools. I think our school system is doing a great job with risk mitigation. And right now we're not seeing what Louisiana's seeing and some of these other places. My fear is, again, if you don't think the worst, you can't plan for it. And so trying to be proactive in this. So we're not to that level by no means. We just have to, but doing the things vaccination of the adults, shielding the kids around us, or the adults around us from with the kids, vaccination and masking, washing your hands, if you're sick, get tested. Those are all big ones. And to the second question of new developments, medication, standard of care. There are, we have way more information on what doesn't work, and that's good. Sometimes you need to know what doesn't work before you know what works, and so you don't waste time on different modalities that aren't working. And there's a pretty robust system of clinical trials and research that's going on, and so many different medications. So we do have a standard of care that's more streamlined, even more evidence for different type of monoclonal antibody treatments for different severity of illness, and so and I don't want to knock on wood, jinx anything, but we have a better idea of even outpatient management of things, which steroid works, and at what point do you offer steroids, and at what point do you offer a different type of monoclonal antibody. And we know that convalescent plasma really hasn't shown great results. So there are all these things that we have kind of gone up the rungs of the ladder to figure out what's working a little bit better and what's not, in terms of wasting time. In terms of a patient's progress. And then to your first question, with this variant, it's very dynamic in that people are, in my limited experience of a week and a half with this, people get sick a little bit more insidiously than even last time. And so I think as we go forward, we'll have a better idea of how to project hospital numbers and patient numbers. I can tell you that the hospitals are working well with each other. They're talking to the hospital association. They're talking to the outlanding communities, and we are not at a dangerous point by no means. The incident command is on top of things. They have different levels of plans for different numbers of bed availability, but things, knock on wood, right now, from the limited knowledge I know about the census, it's doable, and we have plans in place to try and bring in different levels of staffing as needed. It's hard to plan for something that's not exactly here yet, but again, planning for the worst, hoping for the best kind of thing. So.
You mentioned two things that I wasn't quite clear on. One was that you're still doing limited contact tracing. Is that accurate?
So Haley Bloom is the one that is kind of over some of that. We're just shifting focus on that. One, we don't have the staff that we once did. Do you want to address that further?
Yeah, so the state still has a contact tracing contract with another agency. So sometimes if we can't fulfill all of those contact tracing cases, we do assign those to the state's contractor, and they're still working through those as fast as they can. But at this point, there's just so many for both us and then the contracted agency that they're going back to that priority contact tracing. So, for example, if we know they're a first responder and they work in the medical setting, we're tracing those folks first.
And what we lose when we use the contracted agency is we don't have what's going on in our community as readily available as we usually do. We've been running an ad for COVID responders for a month, I think, and we have we're staggered. We have about 3 people coming, but it is definitely the employees' world right now. They get a different offer somewhere else and they take that job. So we're desperately trying to ramp up our staffing again.
But in your ideal world, you would still be following up on every case and knowing exactly.
In the ideal world, absolutely. Absolutely. And we would like to get back to definitely doing all of Natrona County's positive cases, but I've got 13 openings and there's not a lot of staff out there to find.
Okay. And my second question was, you mentioned that there was at one point a $25 incentive being envisioned, and then $100 now being approved by the federal government. Is that correct?
Yes. So we got approval from the governor's office on end of last week to do the $25 incentive. That was kind of what was being talked about for many months in advance, but everything had to go through the governor's office and different things like that. We are only doing it for those 2 limited areas at this time, just because we just got permission for them. So that's the city of Mills, because they're actually giving money off of the water bill. And then Casper College will just be using Amazon cards we don't have the staffing to do more than that. But then President Biden came out and said that they would be giving out $100 incentives. I can tell you, like, there's no way we can process that through the health department. And Tracy's back there shaking her head like, no, I don't want to be, I can't get into that game. So the state is actually figuring out a way or a process to do that. So a person would have to complete both series of the vaccine or just the one Johnson & Johnson. I don't know what that looks like. I anticipate it would be something that they would submit to the state and then they would get reimbursed from the state. So we're keeping an extremely low scale at this point, just the 2 special projects that were approved by the governor's office. And then we'll divert to the bigger one when that becomes available from the state. It's messy. So just trying to save a little something.
With your increase of cases from July 26th of 41 to August 9th of 171, how many of those were vaccinated?
I would say that we are not separating that out at this time, but the majority from what we know, like just what we see at the health department itself, we know that it is.
I'd say probably 10% of those were vaccinated, breakthrough cases.
Has anybody that's been vaccinated died?
That's my question.
Not that we know of.
Can I ask one more question?
Absolutely.
So those X-rays are pretty scary, honestly, you know, and I think it's my understanding, Doc, not a doctor here, right? But it seems to me like everybody seems to react a little bit differently. Mm-hmm. Did those people have any underlying health issues?
It's a great point. Unfortunately, we all have some type of underlying issue. So you're right. Everyone does react differently, unequivocally. But you can have seasonal allergies and react differently to an irritant. So meaning if you have a reactive airway disease, something simple that's covered by Claritin over the counter, and you get an insult that sets off your inflammatory system, your X-ray could look like that. To your point, comorbidities, other issues can lower thresholds for different ways, different I guess treatment plans and how patients do. But it's to the point now, almost, and I can touch on the contact tracing too. When you have one person that can affect up to 8 to 9 people around you, it's really hard to contact trace that compared to 2 to 4 people around you. And then putting that to the point of comorbidities or underlying health conditions, I got to lose weight. I know it. And that's a comorbidity on my end. So if I get it, I know I'm going to probably struggle a little bit more than my little brother, who's much skinnier and handsome and all that stuff, than what I'm facing. So when we talk about underlying conditions, it doesn't take much to have to set your path a little bit different than others. And sometimes you can have just a hyper-inflammatory response. Cytokine storm is underappreciated, I think, in the science community. In terms, not underappreciated. We should be talking more about that, interleukin cytokines, and that what our immune system does to irritants and insults. And one other thing to talk about the hospital, if I could, sorry. And I think one thing that's been really encouraging is that we're all taking the fight to the outpatient setting. Too much of the time, I think we focus inpatient, and we're ready in inpatient. We're doing a good job on the inpatient side. But the more that we can do in the outpatient world, vaccinations and staying home, getting tested, the better we can keep people from the ER, from the hospital. And so to me, that's where the fight starts from the viruses in the outpatient setting. That was just a tangent.
I think we talked about that yesterday, that we'll make steps a little bit more proactively when we're doing testing. So when we have individuals that come through our line, having just an algorithm that we know, like when we should really direct that person to go possibly to MESA or SAGE. We had a situation that really unraveled us, just like knowing like maybe we could have done something more. So yesterday we talked about the possibility of making some changes, like putting some things that are out in the testing line. If a person has, like, for example, a certain O2 sat, then we indicate, oh, yep, I need you to go to MESA or SAGE right now for more progressive treatment than maybe sending them home and having them isolate on their own. So the whole thing with this is every day when we think that we know what we're doing, it changes either the next day or in a couple of days after that. But it is getting to the point that it's got our attention and we're concerned. In the contact tracing, in the ideal world, going back to that situation, we also would want people to answer the phone and talk to us. That is the other big breakdown that occurs. People are over COVID, and I think you could ask any healthcare provider that they are very much over COVID as well. But unfortunately, it is still here, and it's reared its ugly head in a different way again. So, Tracy.
Is there a reason why with these 141 cases that you're not tracking vaccinated versus non-vaccinated, just lack of staff, or is there a reason behind that?
Too hard to keep up. People would have to, so either people would have to answer their phone and report whether they're vaccinated or not, or someone would have to physically go into the data system and try to find out if they were vaccinated or not. We just don't have that.
And I think the state is trying to put that into the questioning, because we fill out paperwork when we're doing testing and different things like that. The state is very much overwhelmed as well. And we have lost people in the public health sector. They don't want to work in this world anymore. So the losses that we've seen at the state level as well as at our level, but it is something that they're looking at and trying to figure out what that looks like and put the numbers to that. Absolutely. Rachel.
Is there a difference in breakthrough cases between people who get really sick and hospitalizations and death?
Specifically, you're asking, I'm sorry, like number to into this.
Do people who get vaccinated get sick as people who are not vaccinated?
Just on national data alone, we're seeing about 90% and above of the unvaccinated getting severe disease. And that's what the vaccinations are all about, stopping the progression of the cytokine storm. You're creating antibodies to dampen, to stop the virus from creating a severe situation. So you might get mild symptoms, but there's a 90% chance you're not getting symptoms that will qualify you for hospital admission, needing all the things that we're talking about with different treatment plans and oxygen. So the vaccine does help statistically across the nation, even in the UK. There's a lot of different, anyway, a lot of great stats out there, but 90% plus, if you're vaccinated, won't develop severe disease, hospitalization.
What about people that are that have already been infected with COVID? As far as, because they've already got the natural T cells already in their system and everything else, they've already got that immunity already built in. So,
great question.
I love this question, and it's fascinating because we not only have T cells, but we have B cells, the memory cells, and we do know from a lot of different studies that there is also some natural immunity when we receive the. You fight off that infection, but then it gets into the nitty-gritty of asymptomatic, mild, moderate, severe disease. What type of viral load did you encounter? What was your immune response back? So for those that are lucky enough to have asymptomatic disease throughout, the studies have shown that the antibodies don't persist as long as, say, the moderate to severe disease viral load when the immune system was locked in for a good period of time fighting this virus. I don't know if that makes sense. So to your point, yes, there is immunity. It's hard to quantify how much for how long, months, because it really does go to the quality of illness as well as the duration of illness and from when that illness was. So for those that had infection back in October, much different than those that had infection in April, say, to where we are now. So yes, our immune system is fascinating. When you have that kind of immunity plus a vaccine, oh my goodness, that's even more, you're even more set up to slow it down. And there are lots of good studies out there, a lot of good biostats about testing with those that have been vaccinated, those that have not been vaccinated, those with just have had infection, those that had an infection with vaccine, with infection. And so that data is out there. So we know that the more support that your antibodies can, the prevalent they are, the better you can dampen that immune response.
Okay, I got one more then.
Yeah.
Right along with that, are there any prophylactic treatments that you can take that the general public can take that are, and I'm not just talking about prescription stuff, I'm talking about other things too, that reduce the severity of it?
I love that question. As a primary care provider, That's my jam. I love that kind of stuff because we want to keep people away from serious illness. So sleep is underrated. Those that are stressed have shown that their immune system can't fight off infections as well as, say, someone who's getting 6 to 8 hours of sleep. Eating right, all those kind of things. Vitamin D, there's some limited data that the vitamin D in larger amounts can help with the severity of illness, although there's studies in Europe that might be need to be proved a little bit differently, but it goes to the sample size, all these different things. But vitamin D, zinc. Remember my mom talking about Zicam back in the day. I'm like, whatever, Mom. Wow, but zinc, yeah, okay, now I know. So zinc, there's some benefit. It's hard to quantify because, again, the research with these things, we don't have great recommendations of A, B, C, or grade 1A, 2A. Take 5 celery sticks. But I do, and I say that facetiously, but the celery sticks can help with your pH in your urine to prevent uric acid stones in your kidneys. So all these things go into nutrition and sleep and just getting back to what our parents taught us back in the day. So it's not a great answer. We don't have a great formula for preventative medicine, but the less stress that you cause on your whole body, the better.
Okay, thanks. I guess, and I realize that every individual is different.
Yes.
You can't do a blanket across the board.
No, but if I saw you in the street and you were talking about this, I would say, yeah, vitamin D, zinc. Those are 2 big ones. All the studies about ivermectin, they really need to look at the power of those studies a little bit more in depth, and there might be an issue with some of the sample bias and all these different things. And I encourage discussion. I always tell patients, it's Wikipedia bringing up, talk to your provider about this stuff because that's what we're here for, and that's the great conversation, because there are things that we're going to learn about next year, 2-3 years, that we're like, well, okay, that could have worked, or maybe that wouldn't have worked. And so, but to start this conversation now is wonderful. So the prescription stuff is a whole nother process with different trials. So I can definitely speak to the vitamin D and zinc and sleep and mind, body, spirit type of things. And, yeah.
October is typically our month for the flu vaccine here in the county. Are you still recommending that? And if you are, of course we need to get that set up, but also if they are getting the vaccine, is there a waiting period if they just received the COVID vaccine or the boosters coming?
I don't think there is a waiting period for flu vaccine.
Yeah.
Good.
Early on, we thought it was going to be 2 weeks, but to Haley's point and Anna's part, you really can't do it at the same time.
And we have, we're going to do along the same methods. Obviously, we do schedule that we come in, we do the county itself, but we also will be doing the drive-through flu at the Mike Cedar Firehouse again. So that was a dream for us to do, and the college is letting us do that again. So we have those dates already established, as well as we'll be coming back to the county exclusively for that.
Okay, thank you.
Yep. Well, I know it is 10 o'clock, and I just very much appreciate you coming for, I wish there was some day I could talk about something a little bit more happy or uplifting or something. I hate being like the Debbie Downer person, but I want people to know where the resources are, where they can go to get help. That is our number one goal, and our mission right now is just to be readily available as much as we possibly can, but have the facts out there so that we can try to limit the transmission of this virus, and we can get back to doing some other things.